I'm reading the following on behalf of Dr. Marianne Spurgeon of the Myalgic Encephalomyelitis Society of America. There are people in this country who spend decades of their lives in silent, darkened rooms, crippled and in excruciating pain. They are unable to sit up or to stand. They cannot tolerate light or sound, nor can they summon the strength to speak. Some are too weak to feed themselves. Others are paralyzed. Many cannot even focus on a thought. A significant group of such patients have died of complications of this disease, some at a young age, others some 20 years earlier than their peers. Known as myalgic encephalomyelitis, this disease has a long history and has been recognized by the World Health Organization as a neurological disease since 1969. These are severely ill people and others with the same yet mild, these severely ill people and others with the same or similar yet milder symptoms have been tossed into a pot with individuals with depression, mild unspecified fatigue, and pain syndromes like fibromyalgia. These are not the same diseases as ME. This pot is what the government calls chronic fatigue syndrome, a name that was the government's 1988 response to an outbreak of ME in Lake Tahoe in the early 1980s, and resulted in the Holmes criteria, which were broadened in 1992 with the Fukuda criteria, and even further broadened in 2005 with the Reeves criteria. Some youths with ME have died or become worse due to inappropriate treatments such as cognitive behavioral therapy and graded exercise treatment based on these fatigue definitions. ME was never recognized by the US government, but it is not new or fatigue-based. It is scientifically unsound to take people who are sick with ME and throw them into a pot with people whose illnesses look very different, and then to conclude that ME has no universal biomarkers. There are more than 500 papers in the medical literature that show measurable physiological abnormalities in the melting pot of CFS. They show a pathophysiology for all three of these essential components of the ME criteria Dr. Melvin Ramsey described in 1956, circulatory, immune, and muscle impairment. Articles describing all these pathophysiologies in ME patients, although published under the name CFS, are available on my website. Again, it's Marianne Spurgeon, Myalgic Encephalomyelitis Society of America. Although the cause or causes of ME are unknown, the pathophysiology of ME is not medically unexplained. It is available to anyone willing to read the research. Patients who show these abnormalities should be separated from the CFS pot and studied separately as ME patients. The Canadian Consensus Criteria, also known as the CCC, is a description of these ME patients and describes all three of the components Dr. Ramsey originally described. It appropriately identifies milder ME patients and those who are homebound and or bedridden. CFS does not name a specific disease. The study of fatigue and the term CFS should be abandoned. We urge that the IOM cease its redefinition effort and recommend that the government adopt the CCC as a clinical and research definition of ME until more research can be completed. Further, unrelated diseases such as fibromyalgia, depression, or unspecified fatigue should not be lumped or studied with ME. We also urge that ME be called by its long recognized name by the World Health Organization, myalgic encephalomyelitis. Thank you.
Thank you. Our next speaker is Joan Grobstein for Lila Play, I believe.